Hi, I'm Adam Wing,
And I'm Justin Jetmar.
and this is a presentation on tissue adhesives in the medical world for the fundamentals of engineering taught by Doug Cooper at the University of Connecticut.
This presentation is based off the research by DuPont in their Material Science and Engineering department.
The main topics we will be covering are what are tissue adhesives, including their most common uses, how they work and the conditions that they need, and how well they work, both the positives and negatives. Tissue adhesives work much like stitches and staples do, but they have been known to work quicker and easier than the previous methods. Tissue adhesives have also appeared more often in medical procedures. Up until now, it was only used in the emergency room, but studies are now being done to see if they would be a good enough substitute in the operating room. And most tissue adhesives are used with superficial cuts and lacerations. Most commonly known tissue adhesives are Dermabond and Nexabond, and are comparable to products like Crazy Glue and Superglue. Although they are comparable, products like Superglue are too harsh. We are just using this analogy to show what medical tissue adhesives will act like. In this section, we will talk about how tissue adhesives work, what their chemical makeup is, and the ideal conditions they work under. Tissue adhesives work just like stitches or a Band-Aid would, by holding the skin together, protecting it from outside elements. With the use of multiple layers, it provides an almost impenetrable layer of skin. In this layer, the adhesive forms strong bonds, which increases the breaking strength. So in other words, it makes it harder to be taken off the wound. Our main focus is on octyl cyanoacrylate. It is fast-acting and perfect for holding together body tissue. It also loves an environment with moisture because polymerization happens when it comes into contact with water. Although it has weaker bonding than a butyl or methyl group, the octyl group is much more flexible. The fact that it is more flexible and polymerizes with water makes it perfect for use on skin. Just to show the difference between a methyl group and an octyl group, we see that the methyl group has closer, more rigid bonds, while the octyl group has more bonds and further apart. This allows for more flexibility in the molecule and tissue adhesive. This shows what happens in the presence of water. We see here that when water attaches to the molecule, it allows for more molecules of that same cyanoacrylate to attach itself into a long string. This is known as polymerization. Octyl cyanoacrylate is generally a clear, colorless liquid that is insoluble in water. It also can be combined with plasticizers to increase its breaking strength. The reason we focused on octyl cyanoacrylate is because it is the primary adhesive used on skin wounds in the medical field. Another reason it is used in the medical world is because one of its characteristics is being bacteriostatic, or being known to inhibit growth of bacteria, allowing less chance for infections to occur. In emergency and operating rooms, octyl cyanoacrylate or tissue adhesives could be seen to take the place of stitches, staples, and adhesive tape. Not only are results comparable to each other, but it reduces the risk of infections. As of right now, tissue adhesives are used only in the emergency room for traumatic lacerations, but further studies are being done to see if its use can be carried over into the operating room for closing incisions that were made.
This section is devoted to the benefits and disadvantages of modern tissue adhesives. We will also be discussing a new form of tissue adhesive which has a promising future in real-life applications. If applied correctly, the adhesives are virtually painless. This is huge when compared to the pain one might endure when getting stitches. They are also much less time-consuming. They are applied in minutes, not hours. In the future, we might also see field applicators for the on-the-go treatment. With the wound completely sealed by the adhesive, there is much less of a risk of infection, whereas a bandage might gap and stitches might have a seam. Another positive trait is that in most cases, the adhesive will flake off after more layers of tissue develop underneath. To some degree, the adhesives will have some give in flexibility, as well as giving the applicator more precision in realigning the skin so as not to pull. In addition, after recovery, patients saw a greater appearance in their skin, i.e., minimal to no scarring. This process could also be used to realign a tattoo after an injury. Lastly, after the adhesive cures, the wound closure is waterproof. This usually takes about 2 hours. The main idea we are dealing with is that tissue adhesives bring us to the same end result as stitches, sutures, and bandages. Simply put, they get the job done in a much faster and reliable way. Here are some negatives. It is not clear how adhesives will hold at high tension points such as the knee or elbow. Also, at high temperatures, the adhesive could depolymerize. The process of curing also gives off heat and could give off an irritant gas. Actimax is the name of the new tissue adhesive currently being developed by DuPont. It is a hydrogel, or a colloidal gel in which particles are dispersed in water, therefore ideal for a moist environment found in the body. It was registered as a trademark of DuPont in 2006, just to show you how new this process is. Unlike its predecessors, Actimax is engineered for a much faster application, curing, and healing process. In addition to the uses on superficial wounds, Actimax is primarily meant for use within the body, having the ability to break down after a tissue revival. As aforementioned, this product is meant for multiple uses, having slight differences in each component depending on the application site. So just how does it all work? Well, based on the AICHE site, Actimax is obtained by reacting an oxidized polysaccharide with water-disposable multi-arm polyetheramine. It is composed of a dexitrin aldehyde and multi-arm PEG-amine. These components undergo a Schiff reaction to form the hydrogel previously discussed. At room temperature, this binary system cures. It is also designed to be compatible within the moist environment of the body. With the Actimax family of adhesives, a doctor will theoretically be able to choose the best match application for the patient's needs, able to choose between a duration of a hold or simply till the tissue can be mended. When the duty of the adhesive is complete, the compound decomposes by means of hydrolysis. Actimax is not cytotoxic or cell-killing. It does not cause the body to react in a defensive way, and it is at a minimal risk of pathogens entering through the closure. DuPont is currently working on the Actimax family of adhesives and claims to only have scratched the surface on this product and its potential.
In conclusion, tissue adhesives could be the new and better way of closing wounds in the ER or OR, giving a whole new meaning to a second skin. Already findings have shown that the healing process is as good as, if not better than, the older ways of using staples or stitches. Their bonds are strong enough to stay together and close a wound, yet flexible enough to move and stretch with skin. And with companies such as DuPont doing research in this field, maybe there will be ways to bypass the negatives of the semi-toxic gas that's given off and make the healing process go even quicker.